Most people have no idea that pancreatic cancer is one of the deadliest cancers known today, quietly surpassing breast and prostate cancer in mortality rates across many countries.
Okay, let's dive into something quite serious today, but really important.
Definitely.
Most people, I think, have no idea that pancreatic cancer is, well, quietly one of the deadliest cancers out there.
It really is. The statistics are quite stark when you look at them.
Yeah, like it surpasses breast and prostate cancer mortality rates in many places. We're talking over 65,000 lives a year just in the US.
And that 5-year survival rate, it's incredibly low, only about 12%.
Just 12%. It really earns that name, silent killer.
And the silence, that's the core of the problem, isn't it? Nearly 80% estimates suggest of patients overlook those early warning signs.
80%, wow.
Yeah, they dismiss them. Think it's just, everyday aches or pains, maybe stress, until the disease is much further along.
Which is exactly why we wanted to do this deep dive. We've got this health video transcript, and we're going to pull out those critical, often missed early symptoms.
The goal really is to equip you, the listener, with this knowledge.
Right, because it could potentially help with earlier detection. For you, for someone you know.
And what's really striking from the research we looked at is that symptoms can actually show up maybe 3 to 6 months before a diagnosis is even made.
3 to 6 months, that's a potential window.
A significant window, yeah, if those signs are caught.
A window that just gets missed too often. But here's something else from the material that really stood out to me.
What's that?
Recognizing just 3 of these symptoms together, researchers think that could improve early detection odds by almost 70%.
70%, that's huge. It just shows how powerful awareness can be.
Absolutely. And it underlines why knowing the symptoms is so vital, especially given, the pancreas itself.
Right, it's tucked away, isn't it? Deep behind the stomach. Small organ, but does these massive jobs.
Regulating blood sugar, making digestive enzymes.
Crucial stuff. And because it's hidden, tumors can grow there without being noticed, without being felt, until they start messing with those functions.
Okay, so that brings us to the signs. We've got 8 specific ones to talk about. Some are things you'd easily just brush off.
Let's start with the ones linked directly to digestion, which makes sense given the pancreas's job.
Symptom 1 then, digestive problems.
Exactly. So one of the first ways cancer can interfere is by messing with those digestive enzymes. Lipase, amylase, protease.
The ones that break down food.
Right. A tumor can either stop the pancreas from making enough enzymes, or it can physically block the duct, the little tube that carries them to the intestine.
Okay, so if the food isn't breaking down right, what does that feel like?
Well, you'd likely experience persistent nausea, maybe some vomiting, definitely bloating, and just a general feeling of digestive distress, especially after you eat.
And because your body's struggling to get nutrients.
Your appetite often drops off significantly.
Which leads straight to unintended weight loss, I imagine.
Exactly. Unexplained weight loss is a really common sign. You might also notice muscle wasting because the body just isn't getting the fuel it needs, even if you're trying to eat.
Okay. And you mentioned there's a specific sign related to fat absorption, a red flag.
Yes, this one is quite telling, though maybe a bit unpleasant to discuss. Changes in your stool.
How so?
When fats aren't digested properly, they pass through your system. This can make stools look pale, kind of greasy or oily, bulky, and have an unusually foul smell. Schitorrhea, it's called.
Pale, greasy, foul smelling. That's very specific. And yeah, it sounds like something you might just ignore or blame on something you ate.
Precisely. And that's the risk. These aren't just minor tummy troubles, they're signals. Recognizing these changes, even if they seem vague, is so important.
Okay, so beyond direct digestion, what about overall energy? That's another one people blame on everything else.
Right, symptom 2, fatigue or physical weakness. And we're not talking about just feeling a bit tired.
No, the material described it as deep exhaustion, the kind sleep doesn't fix.
Exactly. Relentless fatigue, feeling like you barely slept even after a full night.
What causes that?
Well, the cancer cells themselves consume a lot of energy. They're essentially competing with your healthy cells for nutrients and fuel, draining your body's resources.
So even simple things become hard.
Very hard. Daily activities feel overwhelming.
Yeah.
And it's not just physical either.
No,
there's often an emotional side like sadness, anxiety, frustration. Sleep often gets disturbed too, which just makes the fatigue worse. It's a vicious cycle.
And the danger is mistaking it for stress, aging, overwork.
All of the above. But the key difference with this kind of fatigue is that it lingers. It gets worse over time. It's unshakable. Recognizing that persistent, deepening exhaustion is crucial.
Okay, let's shift gears. Fever and shivering, that sounds more like an infection. How does that link in?
Good question. That's symptom 3. Fever and shivering. It often points to the body's inflammatory response.
Inflammation from the cancer.
Yes. Or if a duct gets blocked and causes an infection, the immune system kicks in, and that can cause a fever.
Is it a constant fever?
Often, no. That's what can be confusing. It might come and go. You could have episodes where you feel intensely cold, shivering, followed by a high temperature.
So fluctuating, not like a steady flu fever.
Right. And the source material mentioned that if jaundice is also present, that combination with pancreatic inflammation can really trigger these temperature ups and downs.
Any other signs with the fever?
Yeah, often things like night sweats, just feeling generally unwell. Again, the key is persistence or recurrence. Unlike a regular bug, these temperature issues tend to hang around or keep coming back.
Okay, now for one that the source is really flagged as often overlooked, blood clot.
This. Symptom 4, blood clots. Seems unrelated on the surface, right?
Yeah.
But pancreatic cancer can significantly increase your risk. It's called hypercoagulability.
Hypercoagulability, meaning your blood clots too easily.
Basically, yes. The thinking is that the tumor releases inflammatory substances that mess up the body's natural clotting balance. It tips the scales towards forming clots.
And where do these clots usually show up?
Most often in the deep veins, usually the legs. That's deep vein thrombosis or DVT.
DVT, what are the signs?
Unexplained swelling, usually just in one leg. The leg might feel warm to the touch, tender, maybe look reddish, or even bluish.
And the real danger here
Is if a piece of that clot breaks off.
and travels.
Exactly. If it travels to the lungs, it causes a pulmonary embolism, or PE. That is a life-threatening emergency.
Okay, PE warning signs. What are they? We need to know these.
Absolutely critical.
Yeah.
Sudden shortness of breath, sharp chest pain, especially when you breathe deeply. A rapid heartbeat, maybe irregular.
If you experience those, it's immediate emergency care. No hesitation.
No hesitation at all. Understanding that link, that unexpected leg swelling or sudden breathing trouble could be related to something like this is vital information.
Okay. Now, sometimes the tumor itself can physically affect nearby organs, right?
Yes, which brings us to symptom 5, swelling of the gallbladder or liver. The pancreas sits really close to them.
Right.
So a tumor can grow and actually press on or block the bile duct.
The duct carrying bile from the liver and gallbladder?
Correct. Bile helps digest fats. If that duct is blocked, bile can't get through to the intestine. It backs up
Backs up where?
into the gallbladder, making it swell up. It's normally quite small, like a little pear, but it can get noticeably enlarged. Bile also backs up into the liver, causing it to swell.
Can you feel that?
Sometimes a doctor might feel an enlarged liver during an exam, like a firm mass under the right ribs. But imaging, like CT scans or ultrasounds, shows these changes really clearly.
So doctors look for this swelling.
Definitely. It's a key indicator of a potential blockage, showing how interconnected these organs are.
Let's loop back to digestion again, specifically gas and bloating. How is this different from the general distress we talked about first?
Symptom 6, gas or bloating. It's related, still tied to that enzyme disruption, but it can also manifest as this persistent feeling of fullness or pressure.
And wasn't there something about feeling full really quickly?
Yes, exactly. Early satiety. That's feeling full after just a few bites of food.
Why does that happen?
It could be the enzyme issue, but also the tumor itself might be physically pressing on the stomach or the intestine, just reducing the space available.
So you eat a normal amount or try to and just feel stuffed, bloated.
Yes, bloated, tight, maybe even a bit nauseous when you wouldn't normally feel that way. And again, the key here is persistence.
Not just after one big meal.
Right. It's stubborn. It doesn't really improve with antacids or changing your diet. Your abdomen might feel swollen, even when you haven't eaten much, and it lasts.
Easy to blame on stress or indigestion again.
Very easy.
Yeah.
But if that persistent bloating or early fullness sticks around for several weeks with no clear reason, that's a signal to get checked out. It's another one of those subtle but crucial windows.
Okay, symptom 7 is pain, and the location matters here, right?
Very much so. Tummy or back pain. Where the pain is felt can often suggest where the tumor might be, especially if it's in the main body or the tail of the pancreas.
What kind of pain is it typically? Sharp?
Usually not sharp, more of a dull, persistent ache deep in the upper abdomen.
Upper abdomen.
And characteristically, it often radiates through to the back. People sometimes describe it as feeling like a band tightening around them.
A band-like feeling. Does anything make it worse?
Often feels worse after eating, or sometimes when lying flat on your back.
And what's actually causing the pain?
It's the tumor pressing on nerves and the organs around it. It's often described as this sort of gnawing feeling or like a constant heavy pressure.
Does it start constant or come and go?
It might come and go at first, but typically, as things progress, it becomes more persistent, more intense. Understanding those details, the location, the type of pain, when it happens, is really important for diagnosis.
Okay, finally, symptom 8. This is a visual one that I know I would probably just dismiss. Dark urine.
Dark yellow or brown pee, yes. Easily dismissed as just needing to drink more water.
But it can be more serious.
It can be one of the very first signs of jaundice, which is often caused by that bile duct blockage we discussed.
Right, the tumor blocking the bile duct. Why does that change urine color?
Okay, so your body breaks down old red blood cells, producing a yellow substance called bilirubin. Normally, bilirubin goes into the bile and out of the body.
But if the duct is blocked,
Bilirubin can't get out that way. It builds up in your blood. The body then tries to get rid of this excess bilirubin through the kidneys.
and that makes the urine dark.
Exactly. Dark yellow, sometimes even brown, like cola or strong tea. And this can happen even if you are drinking plenty of fluids.
So hydration isn't the issue here.
Not if this color persists. If your urine stays unusually dark for more than a day or two, even when you're hydrating well, that needs immediate medical attention.
Immediately. Why so urgent?
Because this dark urine often shows up before the more obvious signs of jaundice, like yellow skin or eyes. It's a potential early warning sign. Don't wait on this one.
Wow. Okay, so let's just recap this. What we've pulled from the source material is clear. Pancreatic cancer might be silent, but these symptoms, they're like quiet alarms.
They really are. They aren't just everyday annoyances, even if they start that way. They're distinct changes.
Persistent changes affecting digestion, energy, clotting, waste removal, fundamental things.
Right. And the really empowering thing here, the big takeaway from this deep dive, is that knowing these signs gives you an advantage.
That dark urine, the deep fatigue, the stubborn bloating, that specific back pain, the leg swelling, recognizing even a few.
It gives you time. Time to see a doctor, time to investigate, time to potentially act much earlier.
And that stat, again, spotting just 3 symptoms together, might boost early detection odds by nearly 70%.
It's a powerful reminder that knowledge, in this case, really can make a difference. It empowers you to listen to your body differently.
To advocate for yourself or maybe for someone you care about if something just feels persistently off.
Exactly.
So thinking about all this, how easily these signs can be missed, written off. What does this deep dive really tell us about how important it is to truly listen to our bodies? To investigate those persistent, nagging changes, even if they seem minor at first.